Okay, welcome back everybody. Now DVT's a long one, so grab a pen and some paper, buckle up, pause, rewind, and please test yourself along the way. We have 3 Medmonics in this video, so it will be intense. Now, even if you remember only 50% of them, you'll still do better on your final exams. So let's go. Okay, so here you can see the deep vein trombone DVTs, which are commonly found in the lower limbs. Now they're important because if they're left untreated, they can lead to fatal pulmonary embolism. Now they're uncommonly found in the upper limbs, but if so, always check your patient for underlying cancer. Now how does it occur? The pathophysiology includes at least one of Virchow's Triad, and that is endothelial damage inside of the veins, a hypercoagulable state, the hyperventilating hyco clogs, or venous stasis, the venous flytrap choking the stop sign, which is all about slow-moving blood in the veins. Now this is the Medmonic to remember all of the risk factors for getting a DVT. It's in the form of C, a pregnant mum with 2 thighs over 45. Now test yourself at the end and see if you can remember it. Pause and review for the benefit of active learning. Okay, so C is for COVID. Not all viruses can cause them, but COVID might. Now we've got a pregnant mum, which indicates that pregnancy is also a risk factor for a DVT. And you notice our mum is wearing an American flag, which shows the American spelling of mum, M-O-M, because M stands for malignancy, the cancer can. O is for obesity, and the next M represents medications, with the next Medmonic of the thong on the mat. So from a medication point of view, T is for tranexamic acid, H stands for hormone replacement therapy, O is for the oral contraceptive pill, N is non-compliance with blood thinners, G is for glucocorticoids, M stands for monoclonal antibodies, A is antidepressants, and T is for testosterone. Now back to our primary Medmonic, we're up to 2 thighs with the 2 T's and 2 S's. The first T is for trauma. It doesn't have to be that traumatic. You can hurt yourself by bumping a table, for example. The second T is for travel, such as a long flight, a long drive, or long train rides. H can be any form of hospitalisation, I is for any form of infection, and G stands for genetics. Here is another Medmonic we use to remember the specific genetic risk factors. Here we have the gene that claps. Now remembering these will get you those extra marks for your finals and will help your patients in the long run. So stay with us. CLAP stands for C is for protein C deficiency, which is common. L is for factor V Leiden, which is common. A is an antithrombin deficiency, which is rare, but also if you have a patient with recurrences of venous thromboembolisms or miscarriages, always think of antiphospholipid syndrome. P is a prothrombin deficiency, which is common. And finally, S is a protein S deficiency, which is rare. Now back to our primary Medmonic, we see that another risk factor is having a history of DVTs. S is if they have a sedentary lifestyle, being immobile. And finally, S is for sick or old, which is classified as over 45 or 65, depending on what resources you read. Next is how to determine whether your patient has a DVT, and we use the Wells score, which provides the pre-test probability of your patient having a DVT. You can download MD Calc at the App Store, and the Wells shows the Wells score for DVT. Now, if you select yes for any of the following, each one gets a point except for the last one. If your patient has had active cancer within 6 months, you can see the exercising active cancer cans with a 6-gun shooter and moths flying out representing 6 months. Or if your patient has been bedridden for more than 3 days, the stool represents 3 days because it has 3 legs. Or if they've had a major surgery within 12 weeks with the 12 eggs weeing into the wound, showing 12 for the eggs and the weeing is weeks. If they have unilateral calf swelling more than 3 centimetres, which is depicted by the swollen calf and 3 cents on the stool for the centimetres. If they have collateral superficial veins, if the entire leg is swollen, if there is localised tenderness, like pain, or if they have pitting edema. Next, if they have any of the 3 Ps, the parachute for paralysis, the Eiffel Tower in Paris for paresis, or if they have had a plaster cast, any of these, then add 1 point. Now, if they've had a past history of DVT, add a point. However, If there is any alternative diagnosis that is more likely, such as a Baker's cyst or cellulitis, then subtract 2 points. This gives you a final score to help guide the next best step in management of your patient. Okay, so that's a lot to take in, but trust me, if you can master this short video, you're well on the way to impressing your residents and registrars. What Medmonics do you use for DVTs? Please just let us know in the comments below and let us know what you want to see next. So we've provided a link to the free notes on DVTs for you, the link's in the description below, but be aware that we'll be posting free exam questions at a later date. So please like, share, subscribe and click the notification bell if you'd like to get further updates on our content and when those questions are posted. Thanks for watching. We'll see you next time.